This is a short video that gives information of a study that is being carried out by the University of Birmingham. This video has been made by the researchers carrying out this study. The title of the study is The Effect of Home-Based Exercise Intervention in Dementia Patients on Risk Markers for Dementia. What is the purpose of the study? Exercise is beneficial for health. The study will examine if increasing physical activity by 10% in dementia patients will improve physical function, quality of life, potential biomarkers of dementia. Do I have to take part? Taking part in the study is entirely voluntary. It is up to you to decide if you want to join the study. Taking part in the study will not affect the standard of care you receive. What will happen to me if I take part? You'll be asked to visit Care Companions on 3 different occasions. Each visit could last around 2.5 to 3 hours. On the first visit, we'll ask you to sign a consent form to keep a record that you're happy to take part in the study. You will then be asked to fill out a general health questionnaire and take part in a cognitive test that is commonly used to test for complaints of memory problems. We will also measure your brain blood flow from the side of your forehead using an ultrasound technique. Next, we will give you movement sensors that track your activity for the next 7 weeks. This is a small waterproof device, much like a watch, to be worn on the wrist. On the second visit, we will take some physical measurements, such as height and weight. We will ask you to do some physical tests that will require you to walk for a couple of minutes. If you're happy to, we will take urine and blood samples from you. We'll ask you some questions from a questionnaire which assesses your quality of life. Finally, you'll be allocated to the control or an exercise group for the next 6 weeks. If you are put in the control group, you will be asked to continue your normal routine. If you are in the exercise group, you will be asked to try and increase your physical activity in your daily routine over the next 6 weeks with the help of your carer. This can be, for example, by taking a longer walk or walking up the stairs. After the 6 weeks, you will visit Care Companions for your final visit, where we will repeat the measurements and samples taken during the first 2 visits. Can I take part? We're looking for individuals who fulfill the following criteria: diagnosis of dementia, is 50 years and above, have not been advised to not exercise, are not receiving treatment for cancer, coronary heart disease, pulmonary edema, and diabetes. Are there any risks from taking part? The most obvious risks to you will involve blood sample and exercise. With all blood sampling, there is risk of momentary discomfort or bruising. However, the researchers are trained and experienced phlebotomists. During vigorous exercise, there is a very small risk of cardiovascular event, such as a heart attack. However, we will not ask you to exercise vigorously. We would like you to increase your physical activity gradually by increasing the amount of physical activity you do over the whole day. What are the possible benefits of taking part? Although we believe that this exercise intervention will be beneficial to your health, we cannot promise that taking part in the exercise intervention of this study will help you. If you are in the control group, You may not benefit from taking part. However, you will be providing valuable information that may help improve treatment of people with dementia. What will happen if I don't want to carry on with the study? You can withdraw from the study at any point during the study without giving any reason. If you have any questions, please do contact any of the researchers of the study listed below. We thank you for taking time to consider this study.